Imagine yourself on an operating table in the early 1800s, wide awake, about to undergo surgery. A procedure that you have decided to do as a last resort because the pain is unimaginable and you would voluntarily never really want to sign up for that. That was the reality of every patient before the 1800s and before we discovered anesthesia. Operating rooms echoed with agony and screams and the hacking of limbs. At that time, surgeons were admired for two qualities. The first was speed, and the second was brute strength. The faster they could cut, the sooner the ordeal ended. There was even a surgeon who gained infamy because he could amputate a leg in under 30 seconds. And usually you had assistants who held down the breathing patients, and it was not uncommon for a patient to faint or go into shock from pain and just never wake up. And because of how truly desperate things were, patients and doctors tried everything. They tried getting patients to get drunk by giving them alcohol and whiskey so they would get to near insensibility. They also tried herbal potions like opium. Sometimes they tried biting a bullet. And the reality is, no matter what they did, it really just came down to the speed of the surgeon. Getting a surgeon that could operate as fast as humanly possible while being held down by assistants was probably the best surgery experience for people at that time. There's a patient known as Fanny Burney who underwent a mastectomy without anesthetic, and she wrote a personal report of what that experience was like. She described the very moment she felt the steel plunged into her breast and cut through veins and arteries. And she described how she screamed until she had no more scream left in her. There were so many of such harrowing accounts that surgery was often called torture. And that's because both patients and surgeons often came out of surgery traumatized by the brutality of it all. But before we had what we now know as anesthesia, the quest to relieve surgical pain had really started way before, when a medieval Persian physician known as Sina decided to soak herbs like opium and mandrake and place it under patients' nostrils. This would often induce drowsiness and, to a certain extent, reduce the sensation that patients felt. In Europe, there was also a potent brew known as Dwale, which was mixed wine and opium and hemlock, as well as other botanicals that were just intended to knock the patients out. But most often than not, it just poisoned people. While these concoctions were made to dull pain, a lot of the times they were unreliable. And oftentimes you just get a patient getting drunk to stupor, which meant they would still be able to feel pain. So the real test of fighting pain was to fight against consciousness. If patients were not conscious during surgery, then they could not feel pain. And so in the 18th and early 19th centuries, science began offering new hope. And that's because chemists started trying to isolate gases that could produce euphoria. The first of such gases was nitrous oxide, which is known as laughing gas today. There was a chemist that noted that not only did this gas cause people to have the giggles and laugh uncontrollably, but it mysteriously relieved his toothache. So he started using this when he was performing dental surgeries. But his idea was ignored because he was a little bit too early. And so, and instead, nitrous oxide became a party gas. It was used by people who went to parties and just wanted to get a little bit tipsy. And even though his idea was ridiculed at the time, we really have dentistry to thank for what we know today as anesthesia. Because even though the scientific community had riddled laughing gas as party gas, in the mid 1800s, a few dentists started really just self experimenting with these gases because they noticed that when patients were under the influence of this gas, they could endure a little bit more pain. And that meant that they could perform minor procedures with patients feeling a little less pain. And it worked on him and a few patients so well. But because he had a public demo that failed or misfired, which was essentially just the patient groaning during the procedure, the observers deemed it a failure. And this single setback almost ended the idea. But then later that year, another dentist in Boston decided to use another type of laughing gas, which he said was more potent. And then he performed another demo, and surgeons and students gathered to ridicule him as they had done his previous colleague. But when the surgeon in Boston administered the inhaled ether to the patient about to undergo the removal of a neck tumor, the anesthesia took hold and the patient went limp. And then the surgeon went ahead and cut into the patient's neck, and there was silence. no scream, and the patient kept breathing steadily throughout the operation. And when the patient awoke, he said he really felt no pain, only a sensation as if a blunt instrument had scraped across his neck. And that's how the era of surgical anesthesia dawned. News of this demonstration spread like wildfire across the Western world. And suddenly, what had been nearly impossible was now real. Surgery could be done without pain. The only person who did not celebrate this achievement was a surgeon known as Robert Liston, who was known as the fastest knife in the West. And that's because he could perform an amputation in under 3 seconds. But this surgeon, Robert Liston, had such a high fatality rate in surgery because he would accidentally even injure bystanders as he tried to quickly cut through joints. But of course, now he was threatened because if patients could sleep through anesthesia, then the need for speed was no longer that big of a deal. Even though the original dentist who proposed the more potent ether to be used for the patient with the tumor in his neck was never properly credited for discovering this technique, because after the technique spread, a bunch of copycats came on and took over his invention. We still have him to thank for pioneering what we know today as modern anesthesia. And thank God it didn't end there, because while sulfur ether was great, it had a strong nauseating odor and was highly flammable. And so, just a few months after that, another anesthetic contender emerged, known as chloroform. And chloroform emerged because a few physicians in Edinburgh, Scotland, were having dinner and experimenting with various chemicals at the hospital. And the chemical they were playing with one night was chloroform. And when they inhaled the chloroform vapor, they all suddenly passed out on the floor and woke up a few hours later. And one of them noted that the sweet smelling liquid that was chloroform could induce a deep sleep like state. And so he introduced chloroform as an alternative to ether, and it quickly caught on as well. Chloroform was gentler on the nose, it didn't have a bad smell, and it was non flammable. And the thing is, just like every medical discovery, there were a lot of older surgeons that grumbled. You can imagine all the surgeons that had grown used to or accustomed to having surgery that involved a lot of pain. And so they tried to push back against the use of anesthesia by arguing that pain was inevitable. There were even a few religious voices that argued that easing pain was against God's will, especially when it came to things around childbirth. Some things seem to never change, apparently. But it wasn't until when Britain's Queen Victoria decided to use chloroform for the birth of her eighth child that a lot of these critics went silent. Her public approval gave anesthesia a huge stamp of legitimacy, especially for obstetric pain relief. And it also helped silence the religious clergy and the religious people who had called anesthesia ungodly. After all, if it was good enough for the queen, who would dare say it was improper? So the discovery of anesthesia stands as one of the most brilliant case studies in medical innovation. Anesthesia as a whole continues to evolve, and now we have a whole specialty in medicine that is dedicated to the study of anesthesia. It has also transformed medicine as we know it because it has allowed surgeons to unlock new frontiers in performing longer, more invasive surgeries. These were all things that could not be possible before. So the next time you undergo a medical procedure and you feel no pain, remember to say thank you to all the eccentric chemists, the daring dentists, and the forward thinking doctors of the 19th century, as well as the Queen of England from that time.